Welcome to another episode of In the Know. I'm your host, Hank Van Joslin. Today is April 14th, 2020, and most of us are working out of the house or staying close to home with the stay home, stay safe orders that we have nationwide. No one knows when things are going to come back to normality. Really, what's going to control that is how we combat this coronavirus. And to help us understand where we are right now today, we've invited back again Dr. Vipul Desai from the Houston Center for Infectious Diseases to sort of navigate us through the most current information. Dr. Desai, welcome back.
Thank you for having me, Hank. We don't even have to do elbow bump this time. We're safe enough here like this.
Absolutely, we're actually following the orders that are in place, and I'm sure that it's rather difficult for y'all because you're there at the office on the front line. Dr. Desai, tell us please, last time we spoke was almost 10 days ago. Tell us what has happened since then, where you see this battle we're fighting against the coronavirus here in South Montgomery, North Harris, and throughout Texas, touching on, of course, nationwide in the world. But help us understand where we are, what you're seeing, what successes you're having.
That's a great question, Hanks. From last time we spoke, a lot has happened. We made a lot of progress, even though it doesn't feel like it in the community and nationwide. But we've made a lot of progress in a very short while. As far as the nationwide, we're still seeing new cases. New York area, as you are well aware, is hit the hardest, along with Louisiana and the Midwest area is being hit a little bit hardest. But from what I understand and some of the feedback that I'm getting from the CDC and so forth is that we're beginning to see a little bit of a decline in the hospitalization in the New York area, so which is definitely good news. Now, locally, since mid-March, I had predicted that our peak around Texas would be April 15th to the April 20th, but from what I understand from the briefings this morning, that we expect to have our peak here in Texas area probably around April 25th or so. We do feel that the measures that being implemented are helping. We are beginning to see the signs of flattening the curve. We're not there yet, but we are beginning to see that for sure. The social distancing, the wearing the masks, that's something new that has come up since last we spoke, that we're encouraging people that if you do have to go out, that you wear a mask, that you wear something like a bandana or something that you could order online or something like that, but not the medical masks. We do urge you to not use those and donate them if you can to your medical health professionals, because those are very, very in short supplies right now. So, but when you go out and if you do have to go out, we do ask you to cover yourself up. But and remember, it's not to protect yourself. It's basically so you yourself do not pass it on. And what we're trying to achieve here is that we don't want you to, and you may not even have the symptoms. You may be an asymptomatic carrier, is to go and maybe give it to someone else, and then it continues the process. So along with social distancing, along with wearing the masks, we're beginning to see the first signs of flattening the curve, Hank. So as we see things improve, we start seeing things improving from east coming down towards the west. So China have pretty good success, and they were reporting no new cases up until lately, which I do want to talk about that later. We're beginning to see decrease in hospitalization in Italy, in Spain, reporting less deaths, and it's moving over to this way. So we are beginning to see the first signs of flattening the curve, Hank.
Well, very, very interesting. But let me ask you this couple things. But what many of us are curious about is, what does hitting the peak, reaching the peak mean to us right here in Texas? And let me do two questions like they do on most of the interviews. This question that goes along with that is that, so we hit this peak roughly on the 25th of April, but if new cases or new positive cases come into our immediate area from outside, be it travel or community spread, then does that whole cycle start all over again?
That's an excellent question, Hank. You know, when I talk about hitting the peak, we want to see where the incidents are not continuously increasing more and more. Just because we go past, and if our peak is at that time, going past that April 26th and onwards does not mean that we're good and we can go back to our normal activities. We still will see new cases coming up, but we want those cases to be smaller and smaller each day. And so we want to see the other side of the curve, where we see less and less hospitalizations, less and less new cases, less and less new death, smaller cases of deaths being reported. As you start, now, one of the things that has hurt us a lot actually is the economy, and we as professionals in the medical community, as well as the politicians, are understanding the implications that this sort of social distancing and closing down non-essential facilities, we know what it's doing. However, we do need to, as we get out of this curve on the other side, we'll have to do a couple of things, Hank. We'll have to do at least 4 things here. We'll have to ramp up our testing, okay? Then we'll have to isolate the positive individuals. Then we'll have to trace. We'll have to see where they are and who they came in contact with, so just tracing. And the 4th thing is to quarantine them. So we will need to do those 4 things as we come out of this curve on the other side. Something else new that is coming up from the last time we spoke is that the testing has become quicker and faster. I'm hoping to hear, like this week, about the antibody test that is supposed to come out by the end of the week, and that would be amazing if we could test quickly and get an antibody. And if it shows that you're antibody positive, then we can slowly start adding these people back into the community and start working again.
So if you're antibody positive, that would mean that you are safe, that you're not contagious now. You've actually gone through the process, or you've had the virus and your body has combated it appropriately. And so you're not someone that could spread it anymore. Is that correct?
Generally speaking, that's usually what it means. So if we're able to mount a good antibody response, we shouldn't be able to get the infection back again. It's not always the case, but generally speaking, that's what we're trying to achieve with this testing process. We did see in China that as you close everything down and you restrict the movement and you kind of suffocate this virus, and as you're coming out on the other side of the curve, and as you start opening up the society and the economy back up again, you're beginning to see some spikes again in China. So that's what's happening again now. So I do want people to understand that what we're doing is working. It's slow, but it's working. When we do open back up again, we're going to have to open up carefully and slowly, and we're going to have to find our people, our patients who have had it, who will no longer be threat to the society again, get them back out working again, and then whoever is positive, we need to isolate them and then quarantine them. So we'll have to be continue to be aggressive in the month of May.
So what'll happen though with the asymptomatic people? I understand people with symptoms and that are feeling sick are going to voluntarily go to be tested, et cetera, et cetera. But what about the thousands or tens of thousands of other people? Uh, the timing for this just seems monumental. How can
Correct.
this happen? How can this happen quick enough to where things can go and things can go back to somewhat normal and we don't see the spikes? And I know that's a tough question to ask, but what do you see if this antibody positive test is available soon? Then yes, it sounds like it's something that would work. However, how do we implement that, and to which sectors of industry and business do we first start to administer those to?
Yeah, that's a great question, Hank. Obviously, we want the medical community to be tested and be out in full force, and then we need to have the transportation and the grocery stores, the pharmacies, things like that to be up and running. And then we slowly have to add each sector into our community. Ideally, we would like to test everyone that we can. I just don't think we'll have enough of that testing capabilities and the speed of it to get these people tested. But as we go forward, we would like to have tests and then get them out into the community. Yeah.
Okay, so right now at your office within your practice, what are the tools that you have available today to test for and to combat the coronavirus right now today?
So right now we are able to see patients that are because we're a full-fledged infectious disease office. We are at this point kind of limiting to seeing patients that we can see. Right now, when I have the capability of seeing patients that are COVID positive, or patients that are having full fevers and stuff like that because of the other patients involved. So we have a positive test, we ask them to quarantine themselves at home, and then we keep a track on the patients to see how they're feeling. We'll let the county know as well, so we can continue to keep an eye on them. We, especially as what we're seeing in this particular virus is that we're seeing younger individuals being affected more than I had anticipated, like our 40-year-olds, 50-year-olds, and about 10% of those that are hospitalized in that age group are dying, and that's a very, very high number compared to over age 85. 40% of those patients are like passing away, and you have to ask yourself, why is this happening with male predominance, and then demographic wise, how is it affecting us? So we have to look into all of this. Right now at this particular clinic, we're able to continue to offer other sorts of care and infectious disease care that kind of takes the burden away from the hospital setting, so they can focus on the more sicker patients.
Okay, so I understand that. Now I know that you and your other doctors there and your practitioners, you're actually visiting hospitals or seeing people that are in need and that have had a situation with the COVID-19. But what you're saying is that at the actual practice, you still have to continue to treat all the other infectious diseases that you have active cases and patients, and that's totally understood.
Yeah, absolutely right. Now, in the Woodlands and the Montgomery County area, with the three big acute hospitals, Memorial Hermann, Methodist Hospital, and St. Luke's Hospital, they're doing excellent care. They're doing a great job here, and our teams are involved in a consultation forum, and we are seeing on a daily basis these COVID positive patients. You know, as we get called in, we treat them, we evaluate individually. If they're not sick enough, we get them discharged home, quarantine them, and we do keep a close eye on them. And one of the things that we're seeing is that as you're infected and as days go by, and around this day 10, day 11, we see patients get a little bit more sick, and there's something called a cytokine storm that we see in certain individuals, and just the body's trying to mount this response to this foreign substance, and they can get sick quickly. So we do want to keep an eye on them on that aspect of it, and if we've got them home and they're having these symptoms, we have them come back to the hospital where we can treat them, and we have standard treatments, we have some novel treatments, you know, so, but we are actively involved treating them every day here in the acute hospitals.
Well, that's excellent to know. It sounds to me like you must have to have added additional staffing administratively just to track these people if we're having to follow and monitor those that are self-quarantined or that you've well, I guess it is self-quarantine, it's a voluntary thing. Is that a fact too? I mean, do you have people specifically dedicated to that function at your office, or is that the county that does that?
Yeah, we do as well. However, the county is very, very much involved, very, very aggressive, checking, and they're doing an excellent job. They're working very, very hard. The hospital systems have their infection control nurses that are very actively involved in communication with our team, as well as the county as well. But ultimately, the county is responsible, and then they are taking the lead, and then they are tracking these patients, and they do even go to their homes, and then and check with them, check their temperatures, examine them, and we've had patients that the county has told us, you know, that has to be readmitted again. Yeah.
Okay. Well, Dr. Desai, I know there's so much more to talk about, and most of us out here are more confused than anything else, but we're trying to follow all the instructions that the local and state and national government give us, and the advice that professionals like yourself give us. So for those people right now, is it correct that we must continue the social distancing? We must continue the stay home, stay safe. And
yeah, I think that's a great question, Hank. You know, I think as we're continuing the social distancing and the mask and some of those things we're implementing, and we're not used to going out and to restaurants, movie theaters, things like that, is frustrating. But one of the things that I've seen in the community, and it's just not here in Montgomery County, but from what I see in some of the other places, is that people are taking this seriously, that they're doing their part, that they are actually distancing themselves. When I do see at like some of the grocery lines or whatever, I do see themselves spacing themselves out. I do see one of the things that I can continue to encourage is to, keep washing your hands, use a sanitizer with alcohol at 60% or more. It's very difficult to do, but try not to touch your face. All these things, as I had said, Hank, are actually helping and is coming, and we feel like as we're going along, that we will see the difference. We will see the flattening of the curve, but I want to be really, really cautious as we go on the other side of the curve. Is that we cannot let frustrations, we cannot let other factors play into a role of rushing into something which could have another spike, And you know, as the warmer weather comes along, it should help us a little bit as well. But keep in mind, with this particular virus, we could see it going on throughout the summer months, and if other parts of the world that are colder in the summer get to start having this virus as well, then you could feed that into September, October, as we get colder weather here as well.
Oh my goodness. Well, I would say in synopsis, we cannot, according to Dr. Desai and according to everything we've been hearing and learning, we cannot let our guard down. We must be vigilant. We must be obedient. And I say obedient, obey what you know is correct, and keep everyone safe so that we do get past this and things do go back to normal, a new normal, but things go back to normal and we can put this behind us.
Absolutely right, Hank. And you brought up a very good points there. The other thing that I want, you know, you and the viewers to know is that we know a lot about this virus now than we did even a couple of weeks ago, but we don't know everything. It is a novel virus. It is new. We really don't know why it affects certain people more than others. There's comorbidities play a factor and things like that. We don't have the protection like we do with the seasonal flu and things like that. So we do want to respect this virus. We don't have clear-cut numbers, you know, as of today. You know, in the United States, we're hitting 550,000 positive confirmed cases, but you know, I think that could be 10 to 40 times more than what's being reported, because we didn't start the process soon enough, I feel. That being said, as we have more cases, the mortality is somewhere probably below 1% or around 1%, but that's still a lot when you include everything in. So my take-home message is, like, keep doing what you're doing, because it is slowly working. We are beginning to understand this virus a little bit better. We are working on a vaccine. There's a couple of trials going on right now. And then we are beginning to kind of show a new norm as we come out on the other side of the curve, that we'll have to be careful, we'll have to be slow, we'll have to find the people who are positive, isolate them, trace them, and then quarantine them. Is the only way we'll be able to open up the economy in slow meal kind of small pieces. Yeah.
Well, Dr. Desai, thank you so much for your insight and for sharing all of this valuable information. And we thank everyone in your office, in your practice, and throughout the medical community and the service community, and everyone who's out there every day on the front lines, taking care of the business that we're able to take care of right now. So please be safe, and coronavirus, we got you.
Thank you very much, Hank. Thank you.
Once again, this is Hank Van Joslin, and you are now in the know. See you soon.